Many liberals seem to think that those who are veterans or loved ones of them are against healthcare being government controlled because they are conservative. No, it's because they have to rely on the VA to handle their healthcare, and it's usually far more of a miss than a hit. With the cost of healthcare, this is the only choice most veterans that have access to it can have for their financial sanity. A nurse stealing drugs from dying or bad off veterans is not something that surprised me. I have a lot of respect for nurses, as I have seen many work hard for so many. Tara Severino developed a drug addiction and forgot what her primary concern was. That said, she just showed the level of care that veterans expect when they go into a VA hospital. Hopefully there will be some fixes put into place to keep this from happening again, but she made the work far harder for those nurses who do their job and actually care for their patients. So let's get into this. Howdy, y'all. This is Paul, the Redneck Thinker. What we have here is a channel to communicate. I want you folks to be thinking by the time you leave my videos. Why? Because I'm tired of people talking via what other people tell them to think. So, watch my video and enjoy the chance to think for yourself. So, folks, you can go to my Substack. This link's down below. You can research all this on your own. You'll have all the information down there. So, here via DOJ press release is what Severino did. Vanessa Roberts Avery, United States Attorney for the District of Connecticut, announced that Tara Severino, 58, of West Haven, was sentenced today by U.S. District Judge Robert N. Higney in Hartford to 2 years of probation, the first 6 months of which Severino must serve in home confinement for diverting narcotics from veterans under her care while she worked as a nurse at the West Haven VA Medical Center. According to court documents and statements made in court, Severino was employed as a registered nurse with the Department of Veterans Affairs Medical Center in West Haven and was assigned to the VA's ICU for sick or dying patients. From January to July 2023, Severino ingested fentanyl, hydromorphone, and oxycodone intended for patients in her care. In some instances, Severino ingested the waste of a substance, meaning she administered part of the substance to a patient and ingested the remaining portion not used by the patient. In one instance, Severino repeatedly introduced fentanyl into the system of a brain-dead patient after claiming she observed him in pain and having a seizure. She introduced fentanyl to this patient approximately 19 times over a 9-day period so that she could divert some for herself. In other instances, Severino ingested doses of hydromorphone and fentanyl meant for dying veterans as affected treatment decisions made by other medical staff who believed that the patients had been receiving and were unresponsive to their prescribed narcotics. In another instance, Severino volunteered to care for a patient not formally assigned to her and diverted pain medication from him before he died. In order to cover up her crimes, Severino misrepresented in VA medical records and tracking systems that the narcotics had been properly administered to the patient, or in the case of excess narcotics, had been properly disposed of. On June 18, 2024, Severino pleaded guilty to obtaining controlled substances by fraud or subterfuge. Oh, and if you don't mind, like, subscribe, comment. And I've got a link tree down below that's got my social media, and it has my Patreon if you want to help out. Thank y'all. Now look, I don't know what's going to happen to this woman. I have a feeling that her career is over in the medical field, but it makes you wonder how many other times that this has happened. It also goes to show why, yeah, we have a drug problem in this country, and there definitely needs to be some way of dealing with it, but I don't know what that is. I'm not a medical professional. All I know is that another case of VA medical side handling veterans like they don't matter. And I know this happens in regular hospitals, probably far less often than it does in a VA hospital from listening to friends of mine that have worked with the VA medical side of things. But this woman just really, really does not need to have been in the medical field. I hope she gets treatment for her drug addiction. I really do. No person should go through life with a medical addiction or with a drug addiction in any way, shape, or form. But yeah. Also, folks, if you made it to the end of the video, don't forget you can contact me. If you look down below, there's a link tree uh link down there for me, that if you have stories that you want me to cover or whatnot, just click on it, and you'll find my Facebook, my MeWe, and my Twitter. You can contact me at any time. But anyway, this has been Paul, the Redneck Thinker. Y'all have a good day now. Bye. Folks, I just want to say thank you for listening. I want to thank you for taking your time. I want to hear what your comments are about what you think on this topic, because your comments are what's important, not necessarily mine. I don't care if you're Republican, I don't care if you're conservative, I don't care if you're liberal, I don't care if you're Democrat. I want to hear your opinion on these topics. I want to thank you yet again for listening to my video. Like, subscribe, and all that other hoopla. This has been Paul, the Redneck Thinker. Y'all have a good day now. Bye.